Is it painful when you have a speculum exam for a Pap smear? Or are you nervous to have a Pap smear? If so, this one's for you. I'm Pauli, a women's health physical therapist, and this is Beyond the V Women's Health. I am on a mission to shed light on the lack of care, the lack of conversation about these uncomfortable topics, and to create resources for you and provide help. I created this channel because no mom or woman should have to struggle when there are answers. So one of the things that's really frustrating to me is that we have to go get a Pap smear for good reason, but then we never get prepared for it, and that speculum exam can be really painful and uncomfortable. So I want to give you some steps to prepare you to be able to go have this and have it be semi-comfortable. It's not going to be the most comfortable thing, but it's important. The first thing I want you to do is go buy a child speculum. They come in plastic. I'll give you a link. The interesting thing is to understand how a speculum actually works. So not only do you have to insert this funky shaped item, but once it's inside vaginally, they actually crank it open to create more space for them to be able to view your organs. The point is, your muscles really have to be in a position to lengthen and to accommodate that. So I think it's helpful to see what a speculum actually looks like and how it functions, but also, as silly as it sounds, for you to have your own so you can take a look at it and really know what it is that they're inserting and what kind of you're up against, so to speak. So before we even get to you using a speculum, get comfortable with using a tampon applicator first. If that's even too much, use a slim tampon applicator. Start there. Go back and look at one of my previous videos, step 2 in having pain with intercourse. That'll walk you through some of the steps of pressing around the clock. So what you'll do is start with that slim tampon, get comfortable with pressing around the clock, then move up to a regular size tampon, then move up to a super size tampon applicator. And so once you get comfortable there, then I would start practicing inserting that speculum and then removing it. So practice that, pull it out. Then figure out how to kind of crank that thing open so that you're good at it. So it's not inside of you and you're trying to crank on it and it hurts and it's not going well. Get good at opening it from that same angle that it would be sitting inside of you vaginally. And then once you're really good at inserting it and you feel comfortable there and you're good at cranking it open, then insert it, slowly crank, like give it the one click and then let it sit there, and then unclick and then remove it. Most of my patients here in Utah, when they've brought their child-sized speculum with them to their doctor, the doctor has been pretty accommodating, saying, yeah, sure, that's fine, we can use that. And also sometimes even letting them insert and open the speculum on their own accord. One thing that I should mention, if you have a history of trauma, this might be a good idea for you to even consider, just because it puts you in the driver's seat and having that control over your body. Yes, the Pap smear is important, and a lot of times there's medical things that need to occur for our health to be well and intact, but this kind of puts you in control and lets you decide what your comfort level is, the amount of time that maybe you might need, because maybe you might need a couple minutes of stretching before you insert that speculum, versus the doctor just inserting that speculum, cranking it to its full capacity, and then doing the exam. This will give you an opportunity to experience less pain and to be in the driver's seat. If some of this is still intimidating and scary to you, even after attempting this, or even just hearing these suggestions is intimidating or scary, and you're local to Utah or the surrounding area, reach out to me and I'd love to schedule you and help, or check out the link to help you find someone near you. I want to change the conversation on women's health, and I need your help. Like, subscribe, and click the notification bell so you know when new videos are up, and share these with friends or other women that you know would benefit from this. I believe that it's possible for you to improve your health and that you're worthy of getting this help, because you're an heiress and a queen and everything in between.